Today, we have an increase of 2,807 cases, our largest single daily increase in new cases in Utah. Our rolling 7-day average is 1,943. This is an increase from last week when we were at 1,578. Our rolling 7-day percent positivity average is now 19.5%, an increase from last week when it was 18.1%. We currently have 389 individuals in the hospital due to COVID-19. Again, our largest single day count for hospitalizations. And our ICUs are at a 78.5% utilization. We are going to announce today that one county, Millard County, has been able to move from high transmission to moderate transmission. That means that they've met the criteria for decreasing their case counts and decreasing their percent positivity over the past 2 weeks. Millard is now at 292 new cases per 100,000, and the percent positivity is at 12.5%. Thank you.
Good afternoon. You've just heard the report from Dr. Dunn, and it's grim news and it's discouraging. Unfortunately, the news of these higher numbers are not surprising. And if projections that we have coming out of our Department of Health are correct, we're going to see higher numbers in the upcoming days and weeks. We'll continue to see this dramatic increase unless we modify and change our behavior. Again, I think everybody understands that. I know we have these press conferences. I worry that as we announce the numbers, that we just kind of glaze our eyes over or become numb with what's taking place. It's not unexpected what we're seeing right now. It's been predicted. We've been warned by our medical professionals, by our data analysts out there, our scientists, again, saying this is going to cause an overrun of our medical system, particularly our hospitals, and we should be concerned about it. I'm concerned about it, and consequently, because of the concern that I share with many of you, we've had emergency meetings here the last 2 days. We had one yesterday. We're meeting with those involved in the medical profession, talking about our education, our schools, business, certainly those running our hospitals, and trying to find out what we need to be doing. Last night I met till the late hours of the evening with our legislative leadership to get their suggestions and their thoughts about what, in fact, we should be doing as policy modification going forward. Clearly, it relies upon we, the people of Utah, to modify our behavior in such a way that we can, in fact, slow and stop the spread of this virus. This past Saturday, I had the opportunity to meet with Dr. Deborah Birx, who heads the task force of COVID-19 for President Trump and his administration, and also Dr. Bob Redfield, who's the director of the Center for Disease Control. And they were able to share with us kind of what's happening around the country, certainly letting us know, and there's not really a lot of comfort in this, by the way, but 41 other states are having increases and spiking in the virus also. 37 have had the highest spikes they've had since the beginning of the pandemic. So it's not unusual. It's just discouraging and frustrating that we continue to spike when we know that we can modify and bend the curve if we all will cooperate. Dr. Birx and Dr. Redfield have given us some ideas and some suggestions, recommendations related to our social gatherings and how the COVID virus is spread, particularly the need to have probably enhanced testing, expand our numbers when it comes to testing. And the good news, they've pledged their support and help, again, to make sure that we have the necessary resources and supplies for additional testing. And particularly, as we're discovered as part of the evolution and of the learning of this coronavirus, is that people can spread it when they're asymptomatic. And so we've got to expand our testing to allow for those who do not have symptoms to be tested to make sure that they don't have the virus and they're not inadvertently spreading the virus to others. We're going to take a look at our schools and what we're doing with our schools, and so we'll be working with our education folks. We're in the process of refining our recommendations. We have gone to a 3-tier transmission rate, high, moderate, and low. That at least gives us clear understanding of where the transmission is occurring and at what rate. That's going to help us, I think, simplify so we can all understand what the requirements are in the locations where we find ourselves. We're in the process of refining those, and we'll probably have more to talk about that in some specific announcements, probably the first part of next week. So stay tuned. Again, we're working with a wide array of folks that have expertise and to see what we can do to modify and hopefully bend the curve. In the meantime, again, I know we sound like a broken record. The protocol really stays the same. If you're sick, don't go to work. You should social distance. Make sure that you're not in close proximity to other folks who may have the virus. Wash your hands often to make sure you have good hygiene and don't spread the virus yourself or pick it up. And of course, when you cannot social distance, you should absolutely be wearing a mask. Again, the mask issue is one that we've had discussion on. We've looked at 120 studies through Brigham Young University. Everybody that's involved with this, I shouldn't say everybody because there are a minority opinion out there, but the vast majority, 95% of the scientists, the medical experts say that wearing a mask will in fact minimize your risk of catching the coronavirus or spreading the coronavirus. As I've said before, I wear the mask to protect you, you wear the mask to protect me, and it works. Not foolproof, but it minimizes risk. It's just like seatbelts, not foolproof, but it minimizes risk when you wear it. Same with our mask. So with that being said, I guess I want to emphasize as we see these numbers rise, this is not a hoax. This is a serious ailment, a serious virus that creates a serious disease. And we have people that are catching it and are having, not only getting sick, but some of them unfortunately are dying. Now we emphasize the deaths sometimes too much because we actually have about 20% less death in Utah than we have in the rest of the United States on average. That's good news, but one death is one death too many. But the one we need to also start emphasizing more is the long-term impacts of those who get the coronavirus, whether it's the heart impacts, lung impacts, autoimmune system impacts, loss of taste and smell. We have people that have lingering impacts long after they don't have the coronavirus, and at least they're tested negative. So the long-term impacts is something that we should be concerned about. We don't know all the impacts of this coronavirus long-term. Again, this is a new virus, and so we're learning as we go. But please know that we're concerned not only just about death, but we're concerned about the long-term impacts that people have. And some that have had it say, I wouldn't wish it on my worst enemy. It's not a fun thing to have anyway. So last but not least, this has the potential and does, in fact, impact our economy, not only in the short term, but the long term. If we have high spikes in our case numbers, fewer people are going to come to Utah to ski. Our tourism and travel industry, already hard hit because of it, could be continue to have that loss of revenue and loss of opportunity. We're down probably 17 or 18% in the hospitality industry right now today. And unless we get a handle on the case numbers, it's not going to improve. So again, we need to make sure that we understand the impacts in all aspects of our society and do what we can. We need to take our conduct seriously. How we conduct ourselves is important. Again, we can't just blow this off as some minimal thing or some hoax. It is real, and people are being impacted negatively, and our economy is being negatively impacted also. I'd just like to refer you to a front page article in the Deseret News written by Marie Dougherty, who has done the research on the pandemic of 2018-2019, the Spanish flu. And in reading that article that she's prepared, it is eerily similar to what we're going through today. And I would say that we ought to look at the past and see what we can learn from and make sure that we modify our behavior and learn from the past to make it better here and today. Much has changed in the terms of medicine in that time, but unfortunately not much has changed in the term of human behavior. So a good article I'd recommend to people to read and find kind of similarities between this, what we're going through today with COVID-19 and the Spanish flu. Last but not least, and to leave a little bit of a high note here, in meeting with Dr. Birx and Dr. Redfield and meeting with Dr. Hahn, who is the commissioner of the FDA, there is clear belief, and I share that belief, that we're going to have a vaccine here in the next 1 to 2 months. Could happen as soon as the 1st of December. And again, it will be probably limited supplies at that time. That will be vaccines that will be given to our healthcare responders, those on the front lines we need to keep healthy, to our most vulnerable populations, those who have underlying conditions and healthcare needs, senior citizens over 70 years of age. Those will be the first ones to receive the vaccine. We have a plan putting in place so we can roll it out so there will be general dissemination to everybody. And hopefully we'll have the supplies that will allow that to happen by March of 2021. So there is some good news. There's daylight at the end of the tunnel as we see this being developed. 40,000 people in clinical trials and their second wave of that now. So I'm hopeful and cautiously optimistic that the vaccine is, in fact, literally around the corner. That's going to allow us, in fact, to get back to more social normal as we can interact with each other without fear. Again, I want to make sure that we understand we shouldn't fear the virus itself, but we ought to respect the virus, and because it is causing dysfunction and harm to our community. With that, again, I look forward to next week. We'll have more information with all the studies we're doing here and the emergency meetings we're conducting to give more information here the first part of next week. And in the meantime, please follow the protocols we have outlined. And I'll take a few questions. We don't have much time, but we'll take a few right now.
Hey, this is Haley Hendricks with ABC4 News. I have a question for Dr. Dunn.
Dr. Dunn?
Go ahead.
Hi, Dr. Dunn. So I have a two-part question for you here. First, can you talk about the waves of COVID-19, what the waves mean, and what COVID-19 wave Utah is currently in?
You know, we're definitely in a surge that was started at the beginning of the fall, so end of August, beginning of September, that was precipitated by mostly our high school and college age students. That's what started our current surge. However, we know now that it's spreading across age groups. So when we look at kind of different waves, I would say that we're in our second peak. So we had our first peak at the end of May, beginning of June, which was largely started by young working age individuals. And then we were able to see a nice decrease in the summer, and now we're in this current surge that's corresponding with the start of in-person classes and universities coming back together.
Okay, thank you for that. Now, what are your concerns about these peaks, waves, and what are we looking at long-term here? I mean, how many could we see?
Yeah, so what's really concerning about the peaks or the waves is how low we can get in between them and then how high they end up peaking. So our goal in between all of these peaks is to drop the cases really low so that when we're preparing for the next peak, we have a case count that peaks at an amount that's our healthcare systems are still able to care for both COVID and non-COVID patients. So it's really essential that we get the case counts as low as we can in anticipation for the next peak. In terms of what we can expect, I mean, honestly, if we've learned anything from this pandemic, we can't make predictions about what to expect. So I would say that the focus right now should be on dropping our cases as low as possible before the winter sets in, when we know there's going to be environments that are more conducive for COVID spread when we're all indoors.
Thank you so much. Appreciate it.
Yes, I have a question for Dr. Dunn. Actually, I have two questions, if that's all right. First of all, what is the State Department of Health doing to address the outbreak we're seeing at the Utah State Prison?
Sure. So the Utah Department of Health is leading that with Salt Lake County Health Department and the state prison. we are doing regular testing of both where the outbreaks are occurring in the different cell blocks, in addition to all incoming inmates and staff. We're working with the prison to appropriately cohort people who are exposed, people who are infected, to limit the number of spread. Right now, it's really focused on identifying all individuals who have COVID and taking them out of the general population so that they can appropriately isolate and limit the spread.
Thanks. And then my second question is, with the record number of cases today, I'm wondering if we can look now at our new transmission index system and see if things are working, since we've had a couple of weeks for that to kind of settle in and take effect.
Yeah, absolutely. So we know that we can see, well, I guess what we've learned from other states is the impact of different interventions usually takes around 2 to 4 weeks for us to start seeing a drop in cases. And so I believe the transmission index has been in place for a few weeks now. So we would be able to tell if that was contributing to a decrease in cases. So I know that we're looking at that data really closely and determining our next steps as a state in order to drop the cases.
This is Wendy from Deseret News. Governor Herbert, you have mentioned the possibility of testing being available to everyone in the state. Where does the state stand on this currently, and do you believe that will help decrease this surge?
I do believe that testing is a key to being able to find out who has the virus and then allowing us to help them to isolate, be quarantined, and stop them from spreading it to other people. Sometimes it's done inadvertently. We have others out there that are just having reckless behavior. But knowing who's got it, and again, if I could wave the magic wand and test all 3.2 million people of Utah, maybe those over 10 years of age, I would do it, because we could isolate and find out where the virus is at immediately. We're not going to be able to do that, but we need to, in fact, I think, lengthen our stride when it comes to the testing. And what we've talked with Dr. Birx and Dr. Redfield, I think we have the opportunity to do that. I'll have more on that next week. But I think we need to, in fact, increase the numbers of testing and help us to find out where it's at and slow the spread. So testing is a key component. Again, along with that, contact tracing. But we've had such great numbers. In fact, our daily cases are increasing now about 16% per week. That's why the numbers keep going up. And we've got to bend that curve. That's impacting not only those who get sick and those that have a severe reaction, but those who are going to the hospitals. And our hospital increasing numbers right now for COVID patients is growing on a 14-day, 2-week average of about 14%. That's not sustainable. We see why we're having concerns from those who have to provide the medical care, saying we're getting to the point where we're overwhelmed. It's not that we don't have 4 walls to put somebody in a bed, but the personnel that need to go along with the apparatus in that bed to serve them and give them the quality of care which we've come to expect is going to be jeopardized. In fact, it's being jeopardized right now. So again, I think testing is a part of it. There's some other things we're talking about. Again, we'll announce next week. Next question.
Hi, Governor Herbert. This is Sophia Eppolito with the Associated Press. I'm curious, we've heard you and the Lieutenant Governor talking for several weeks now about how a lot of this transmission is occurring in the family units or in smaller social gatherings. And we have heard you calling people to wear masks and calling for social distancing, but the numbers continue to increase and it doesn't seem to be working. Are you considering any enforcement methods at this time? What other options do we have?
Well, we're looking at all options to see what we can do to modify people's behavior, because you're right. Unless we change what we're doing and do something different, we're going to get the same results. And it really boils down to what we, in fact, do as individuals and how we interact with our family members, our friends, people that we don't know. The business community has done a very good job by saying, if you come to my establishment, you'll social distance. We're going to provide ways for that to happen inside my business, and you will wear a mask. We don't see a lot of the spread throughout the business community because they're doing a good job. They know that if they don't do that, people won't come and shop. Their employees will be affected, and they won't have a bottom line. They won't make any money, and they'll be out of business. So they're motivated to keep their businesses safe so that customers come and shop. We're doing good in many other areas, but what we're not doing as good at is our casual gatherings. Again, we go to structured places like school, our young people. We're not spreading it at school. They go there and they're in a controlled environment. They wear the mask. They've been very good at doing this. And then they go home and maybe hang out with friends or their family and neighbors, and they catch it and bring it to school. So the casual gatherings, we don't think that we get together with our family. They're not members of our household. Household being defined of those who live within the four walls of our home. That's a household. But we sometimes have family and friends that we're very, loving, and we like doing things with them. We're a family-oriented state, but they're in a different household. Well, even though they don't mean to, they might bring the virus into that casual gathering. Maybe it's a backyard barbecue. Maybe it's a Sunday dinner. Those kind of things are where we're finding the spread. And that's what we learned from Dr. Birx and Dr. Redfield, and our own data backs that up. So that's an area we can do a lot better. How you enforce it in somebody's backyard, in your own home, is obviously very problematic. It's a matter of us just modifying our behavior because it's the right thing to do. It's not only better for us and safe for our own health, but it's safer for those that we love and care about. So we're looking at all those options, and again, we may have something to say about that next week. Next question.
Hi, yes, sorry. This question is for Dr. Dunn. This weekend, we did see some large gatherings for Halloween, at least 2 in Utah County. A lot of photos of people not in masks. Are you concerned at all that we could see another spike in cases stemming from Halloween gatherings? And when would we start to see that in the case numbers, if so?
Yeah, absolutely. The news and the social media posts around this are very concerning for a potential increase in cases in the next week or so. Typically after these events, if we're going to see a spike, we see it within 10 to 14 days after the event. Especially given the amount of community spread we have right now, it is likely that we will see additional cases because of these large events. So it's just something we all need to take into consideration whenever we're going to these events. We need to be wearing masks and we need to be physical distancing. Otherwise, we are going to continue to see increase of spread of COVID throughout our state. We just can't have these mass gatherings anymore right now.
Thank you.
Let me just add to that too. That's something we're very concerned about. That was kind of a reckless activity done with some kind of clandestine effort to not have the authorities know that they were going to have the event. They said they were going to have it, then they canceled it, had the event, and a large number of young people. Again, I understand being young and invincible and that attitude that we have. But what we're learning, again, what we learned from Dr. Birx, Dr. Redfield, and the data is showing us to be true in Utah, is that you can share the virus even though you don't feel any symptoms. You don't feel sick. And so you're hanging out and dancing, and yet you might have the virus that you're sharing with somebody else who shares it with somebody else. And then it gets to your parents, your grandparents, and those who are more vulnerable. And so our young people really got to take on the responsibility to act responsibly in these kind of environment with the pandemic raging out there. So we hope that they'll listen and pay attention. They can help us solve this problem. We hope they do that rather than being part of the problem. So we're going to watch that very closely, and we'll see what happens in the future. We hope that they'll be responsive to our needs. Next question.
Hi, can you hear me okay?
Yes, Aaron, go ahead.
Hi. So I know that the case numbers we have now are now at the same rate that they were in Arizona earlier this year, when Arizona implemented a lot of really strict, restrictions and closures. They ended up closing gyms and bars and movie theaters and things like that statewide for a few weeks. And even as they've been reopening, the thresholds or the criteria to reopen have been quite a bit more strict than what we have in our transmission guidelines in Utah. Now, I know that you've pointed to the kind of overwhelming percentage of cases that are being transmitted in households and social gatherings, but those have to start somewhere. Like somebody in the household has to get it first. So seeing as, when Arizona did that, their cases went down to like a fraction of what they were and what ours are now. Is there value to looking at business closures, we do see a lot of workplace transmissions too.
This is a unique kind of a situation. Again, I was not around in 2018, or excuse me, 1918, 1919 for the Spanish flu. I may look at like I'm that old, but I'm not. And so we're kind of discovering as we go. It's silent, it's invisible, and so it's really hard to know where it comes from. And we have good data and good science that gives us an educated guess of what's happening, how it's transmitted with aerosol spray out of our mouth or nose. And those situations like a gym where people shouldn't be in close proximity, but maybe are, and they're breathing heavy and aerosol sprays are probably a little more prevalent, we would understand that might be a more higher risky environment. We are in fact taking a hard look at my good friend Doug Ducey, governor of Arizona, and what they've done down there, because they've had significantly higher spikes than we have had, but we're heading in that same direction with Arizona. And so we'll see what we can learn from them and other states, as we always try to look at the best practices. I do know that there's no magic formula. Nobody's discovered if you do it just this way, everything will be better. We've had great success in how we've approached it with a balanced approach, but it's not been perfect. And now we're in this surge that's taking place right now, which we're trying to figure out what we can do. But at the end of the day, it all boils down to people's behavior. And we'll take a hard look at businesses out there. We really don't want to close businesses. We think that has its own set of consequences. And interesting enough, Dr. Birx and Dr. Redfield from CDC and the task force, COVID-19 task force for the administration, have all said to us, we don't want to close down the economy either. We think that's maybe the wrong direction to go. Maybe some modifications of behavior that need to take place to keep those businesses open. But we're going to take a hard look at all those things. And again, as we have a report to you next week with this emergency meetings and review that we're taking place right now, we might have more to share with you next week. So with that, we thank you all. Again, I'm hopeful, I'm optimistic. Again, I think we need to not fear the virus, not fear the pandemic. Let's respect it. We know what it's like. And if you read what happened in 1918 and 1919, the Spanish flu, you'll find a lot of similarities. And guess what? They didn't have as good health care as we have today, and they came out of it. We'll come out of this too. It's only a matter of when and how long. We want to do it with minimum damage to our health, to the people of Utah, and minimal damage to our economy. We can do that, and we will. Thank you very much.